The General Neurologic Examination is going to have several components, and the General Neurologic Examination is generally performed by neurologists. I myself am a chiropractor, but I must say that it's important to have a good grasp of the General Neurologic Examination, because there are times when, in addition to an associated body part that falls within your realm of specialty, like me, I'm a chiropractor, there will be times when your examinee has multiple body parts injured, and you may be required to perform in varying depths and in varying details examinations of different types of body parts. So, for example, in my own physical examination template, I have templated examinations for body parts that are outside my scope of practice. As an example, I have a templated examination procedure for abdominal injuries. I have templated examination procedures for temporomandibular joint injuries, and just as those two just considering those two examples, I don't consider myself to be an internal medicine specialist and a specialist in evaluating abdominal injuries, but as a chiropractor, I can perform a brief or a cursory examination of the abdomen, and then perhaps make an appropriate referral if that's what the case requires. So the same philosophy applies with the General Neurologic Examination. For example, in my own experience, and even this week, I must tell you that I will be examining an injured worker. In fact, it's going to be tomorrow, who had a combined spinal injury and a head trauma injury when she fell backwards, landed on her back, and hit her head. So even though I'm not a classically trained medical neurologist, as a chiropractor, I can do a general neurologic examination. And should any concerning findings arise during the general neurologic exam, I can then make the appropriate referral to a neurologist or a neuropsychologist or a psychiatrist or whatever the situation calls for. So it is important to be aware and to be familiar and to be competent in the general neurologic examination. So let's talk about the components of the general neurologic exam, and then we'll expand on each of these components in some detail. The general neurologic exam is going to consist of the following 5 basic components. Number 1 is going to be the mental status examination. And that's going to give you a good idea about the person's level of cognitive function. You're going to make an evaluation of the speech, which again gives you information about cognitive function and also about different components of the motor function involved with speech, including some of the cranial nerves are involved with speech. It's going to include an examination of the head and face, especially in cases where there's been impact or trauma to the head or to the face. The general neurologic exam will then include an examination of the peripheral nervous system, including the cranial nerves, including a somatic sensory exam and a somatic motor exam. And then the general neurologic exam will conclude with some examination of cerebellar functions. And we'll elaborate on cerebellar functions here as we go. Okay, so with the mental status exam, this can be done on a somewhat informal basis, simply during the history-taking and interview of your examinee. To assess mental status, you're going to make an assessment of several different components. You're going to assess for communication skills. You're going to try and determine whether or not your examinee is basically coherent and whether they employ good communication skills during the interview. You're going to assess the general behavior and make sure that that they don't appear to be abnormally behaving, such as acting hyperactive, such as acting agitated, such as acting quiet or passive or immobile. You're going to assess for the communication style, whether they have appropriate tone inflection, and whether their responses to your questions and comments are generally spontaneous and normal. You're going to make an assessment for overall mood and emotional responses, and you're going to assess such characteristics as euphoria, agitation, affect, whether they're giggling, whether they're weepy, whether they're angry, whether their mood and affective responses are appropriate for the situation. This will give you an idea as to their general mental status. You're going to make an assessment also of the intellectual capacity, their general intellectual capacity. And there's a couple ways to do this. One way to assess intellectual capacity is to have the injured worker count backwards from 100 by sevens. Count backwards from 100 by sevens. So as an example, that would be 100, 93, 86, 79, 72, 65, 58, etc. And you have to be careful with this one because some people have normal intellectual function, however, they're just not very good at math. And as surprising as it may sound to have difficulty in counting backwards by sevens, I have had injured workers who I've examined who actually are not able to complete this simple math exercise. So that doesn't mean that they don't have normal intellectual capacity. It just simply means that they're not good with math. Another way to assess for intellectual capacity is to ask the injured worker to recall past presidents, beginning from the current president, which would be Barack Obama, and remembering back as many presidents as they can over the course of their lifetime and even prior if they're able to. Now again, like the math exercise, this exercise may or may not be appropriate to your injured worker, especially as relates to injured workers who were not born in this country or who only recently emigrated to this country. So in assessing intellectual capacity, there may be some context-specific limitations that you need to be sensitive for. And then finally, you're going to make some assessment as to their long and short-term memory functions. With the speech evaluation, there's 4 basic assessments that you want to be alert for. Number 1 is you're going to make an assessment for dysphonia. And dysphonia is a difficulty in producing sounds. Now, difficulty in producing sounds could be due to central impairment. It could also be due to peripheral nervous system impairment and difficulty coordinating the muscular movements in producing speech. You're going to want to make an assessment for dysarthria, which is difficulty in articulating the individual sounds or units of speech. You're going to want to make an assessment for dysprosody. Dysprosody is difficulty with the melody and rhythm of speech. And you can make all of these assessments simply during your interview with the injured worker, just in casual conversation. You can assess, how are they speaking? Are they producing normal sounds? Are they articulating the individual sounds? Do they have normal melody and normal rhythm of speech? Also, you're going to assess for dysphasia, which is difficulty in expressing or understanding words as the symbols of communication. And to illustrate some of these assessments, I'm reminded of a friend of mine who had a stroke, and he was in his 70s, and this was not an industrial injury, but in any event, this person was a car salesman, and I must say he was quite a talker. He was a very persuasive communicator and had a lot to share. And I remember after his stroke, he had difficulty in getting the words out. He had dysarthria, which is difficulty in articulating the individual sounds or units of speech. He knew what he wanted to say. In fact, he was just dying to tell you what he wanted to say, but he could not get the motor control of his vocal cords and of his pharynx and of the whole speech assembly to be able to get those words out, and that's an example of dysarthria. So you can make these assessments, and you don't have to really be a genius in order to pick up some difficulty that your injured worker may demonstrate during the interview process. With regards to the head and face examination, a couple of things that you will assess for. You want to note if there's any abnormal contours or proportions of the nose, mouth, chin, or ears, perhaps due to a trauma or even due to a surgical procedure. You want to inspect the head to make sure that it's symmetrically rounded. Another thing that you can do is you can look at the palpebral fissures, make sure that they are bilaterally symmetric and that one eye is not suffering from ptosis compared to the contralateral eye. Then you can go through a palpation examination and palpate all the bones of the skull, looking for tenderness or defects or any type of edema, bruising, scar tissue, or any kind of deformity that may suggest an underlying impairment due to trauma of the head, either the head or the face. Okay, let's go on now to an examination of the cranial nerves. The cranial nerves, we've discussed the cranial nerves and the functions of the cranial nerves, so I'll just go through the examination procedures involved with the cranial nerves here very quickly. And as I do so, I want to encourage you to outfit your doctor's bag with all the tools necessary for performing the cranial nerve examination. And actually, it's not a lot of tools, but there are a few specific things that you need to carry in your doctor's bag. Much of the cranial nerve examination can be done simply with basic physical examination maneuvers or basic observation during interview with the injured worker. But again, some of the nerves do require specific examination equipment. So you need to have your doctor's bag outfitted with these specific tools. I mean, how can you do a competent neurologic examination without the appropriate tools? So you will know in advance of your examination of the injured worker if you will be doing a neurologic examination. Like, for example, as I said, tomorrow I have my own examination with an injured worker who had a head trauma. And I'll be checking my doctor's bag today and tonight to make sure that I have all the items that we'll be discussing here right now. So to test cranial nerve number 1, the olfactory nerve, in your doctor's bag you're going to want to have 2 odorous substances. The first is coffee, and the second one that I use is peppermint. And you can test each nasal cavity separately with these 2 substances. And coffee and peppermint seem to be good substances because they are non-noxious or non-irritative substances. If you use an irritative substance, you stimulate pain receptors versus olfactory receptors, and you can get a false positive finding for dysfunction of the olfactory nerve. So you want to use substances that are non-noxious. Okay, so you need to have a little vial of coffee and a little vial of peppermint. And I use one of those little pill containers that you can get at the pharmacy that you can put 5 or 8 or 10 little doses of pills in each of their separate compartments. And this pill container works quite well because you can seal it and it stays snapped closed, and the coffee stays fresh and the peppermint stays fresh. And also you can have a little container full of salt and a little container full of sugar, which will describe the use of those two substances here shortly. To test cranial nerve number 2, the optic nerve, you're going to want to carry with you a Snellen eye chart, and also in your doctor's bag should have a tape measure for measuring out 20 feet from the Snellen eye chart. You're also going to want to have a small pen light or a small flashlight to test the direct and consensual responses, and also accommodation for near vision. So that tests all functions of the optic nerve. To test cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and abducens nerves, that can simply be done by physical examination by taking the injured worker's eyes through the 6 cardinal planes of gaze. So no extra equipment needed there. For cranial nerve number 5, the trigeminal nerve, make assessment of muscle bulk and strength of both the masseter and temporalis muscles, and you can do this both by observation and palpation. And then to test the 3 divisions of the trigeminal nerve, the ophthalmic, maxillary, and mandibular divisions, you can assess for light touch over the eyebrows for the ophthalmic division, along both cheeks for the maxillary division, and along the sides of the jaws for the mandibular division. Okay, so no extra equipment needed there except for either Semmes-Weinstein monofilament and or pinwheel testing using either the sharp or dull side of your pinwheel. For testing cranial nerve number 7, that simply can be done first by observation of the facial muscles of expression, or the muscles of facial expression. So you can ask your injured worker to perform a variety of forehead wrinklings and eyelid closures and puffing out of cheeks and all these different types of facial expressions. That would test the motor division, motor branches of the facial nerve. And then also, in order to test visceral function, special visceral function of the facial nerve, this is where you'll have a dash of sugar to test for taste over the anterior 2/3 of the tongue. And I simply ask the examinee to stick out their tongue and identify the substance that I place on their tongue. And I use either salt or I use a dash of sugar. To test the cranial nerve number 8, the vestibulocochlear nerve, you're going to do 2 things. One is you're going to test hearing, and I just do hearing testing for the ability to detect forced whisper at 10 feet. So I step away 10 feet and whisper and ask if they hear it, and if they hear it, what did I say, by covering first one ear, and then I move to the other side of their body while they cover the contralateral ear and try to identify what it is that I'm whispering to them at a distance of 10 feet. Then to test the vestibular division of the vestibulocochlear nerve, we typically use Romberg's sway test with the eyes closed, and the injured worker should be able to maintain their position without stumbling in the presence of proper function of the vestibular division of the vestibulocochlear nerve. The glossopharyngeal and vagus nerve, cranial nerves 9 and 10, are very similar nerves, and they have superimposed functions. And both of these nerves you can assess, at least for their functions in the upper chest and throat. You can make an assessment during casual conversation with the examinee. So you'll assess for phonation, for articulation, and then also for observation of normal and unlabored swallowing, all of which would indicate proper function of the glossopharyngeal and vagus nerves. Remember also that the glossopharyngeal nerve is visceral efferent to the parotid gland, but as far as I know, there's no way to really test for that function. Cranial nerve number 11, the spinal accessory nerve. With this, we're really testing the spinal portion of the spinal accessory nerve. The accessory portion of the spinal accessory nerve travels with the vagus nerve, and so we really don't have an examination procedure for that. But to test the spinal portion of cranial nerve number 11, we're going to test for strength of the sternocleidomastoid and trapezius muscles. And the sternocleidomastoid muscle is quite interesting. It has some unique innervation. It's one of the only muscles in the body that's innervated by ipsilateral motor neurons. In other words, that does not have crossed over representation. And so the sternocleidomastoid rotates the head. And so when we rotate our head to the left, we are testing the right sternocleidomastoid. When we rotate our head to the left, let me say that again. When we turn our head to the left, we're testing the right sternocleidomastoid. When we turn our head to the right, we're testing the left sternocleidomastoid. And I test these, and you should test these with resisted manual muscle testing in various positions of left and right rotation. And I usually like to test using a combination of both concentric and eccentric contractions. Okay, the trapezius muscle is involved with shrugging the shoulders to the ears and also in retracting the scapula in the back. So you want to make an assessment of both of those functions of different parts of the trapezius muscle. Finally, to test the hypoglossal nerve, we're going to assess for tongue movements. And you're going to test for tongue movements in protrusion and also in lateral movements. And this can generally be done also in observation with the injured worker by assessing their speech. For a more formal examination, you're going to want to do some strength testing with a tongue depressor. So in your doctor's bag, you may want to include a tongue depressor, a vial of coffee, a vial of peppermint. You'll want to have a Snellen eye chart. And I carry my Snellen eye chart rolled up and bound with a couple rubber bands. And I keep good care of it so it doesn't get bent up and beat up. You're going to want to also have a flashlight and a pocket light. You'll need a sensory monofilament, which you'll already have in your bag for use on other sensory exams throughout the body. You'll need to have a tuning fork, perhaps, if you use that for testing cranial nerve number 8. As I said, I simply do forced whisper at 10 feet, and that gives me a good idea of the function of the cochlear portion of that nerve. And then also you will want to have a tongue depressor for formal testing of the hypoglossal nerve. So cerebellar exam can be done very quickly. 3 simple maneuvers will give you a good idea of the cerebellar functions. You can choose from any of the following: finger to nose with the eyes closed. Have the examinee stand with the arms outstretched in 90 degrees of shoulder abduction and with the eyes closed. In alternating fashion, rapidly bring the index finger to the tip of the nose, and you're going to assess for the accuracy of their ability to be able to locate their nose with their fingertip. Any inaccuracy could be a sign of cerebellar injury. Rapid alternating hand movements, also known as dysdiadochokinesia, may show some disrupted pattern of alternating hand movements, which could indicate cerebellar dysfunction. Pass pointing exam is where you have the injured worker try to touch their fingertip to your fingertip as you move your fingertip throughout various positions in space, and assess for their accuracy and being able to do so. And then also classically the heel to knee movement, where the examinee stands balancing on one foot and then runs their heel down their contralateral shin for 3 to 4 repetitions. Inability to perform that movement in a coordinated fashion and also symmetrically bilateral or bilaterally symmetric could be an indication of cerebellar dysfunction. So these are some simple tests. The CHP use these tests. They can be done quickly and give you a good idea as to whether or not you have any kind of impairment in coordination of motor movements going on, which would indicate perhaps some injury to the cerebellum and could perhaps signal the need for a referral for either neurology or neuropsychology, etc. referrals. With regards to the somatic sensory and somatic motor evaluations, those are components of the General Neurologic Examination, and I'm not going to discuss those here because I'm going to go into more detail regarding both of those as we get into the cervical spine and lumbar spine examinations. But if you were simply performing a general neurologic exam, at this point you would then go into an evaluation of somatic sensory functions and somatic motor functions, and that would pretty much conclude your general neurologic examination. And I'll defer a discussion of the sensory and motor evaluations for a short period of time as we go along here. For now, I want to move into some body part specific examination procedures. As I said earlier, we're going to talk about the cervical spine, the thoracic spine, and the lumbar spine neurologic exams. And we'll also get into specific procedures for the neurologic exam of the upper and lower extremities. And so even prior to getting into that, I want to go over some general principles involved with the neurologic exam. Now, the neurologic examinations out in the peripheral nervous system, as involved with the spine and the extremities, is going to consist of some consistent components. And regardless of the area of the body that we're going to be examining, we're going to be performing at least 3 consistent types of examinations. We're going to be doing sensory examination, we're going to be doing motor examinations, and we're going to be doing reflex examinations. And sensory exam allows us to test, do dermatome testing. Motor examination allows us to do myotome testing. And reflex examination allows us to do multiple functions, multiple neurologic function testing. And I'll explain about the components of a reflex arc here as we go. And so let's have a basic review of some of the general principles involved in each of these three types of examination. And let's begin with some general principles of the sensory examination.